I'm Paulin Tay Straughan. I'm a sociologist with the School of Social Sciences, and currently I'm Dean of Students. Our work on successful aging puts aging in a positive light, right? Our respondents tend to focus more on what would keep them positively engaged and reminded us of, the tremendous assets that people who are older can be to their community. Many of our respondents, told us that, and this comes through in the survey as well, that part of this important construct of aging successfully would be to connect to the community, to be able to give back. We talk about an aging community, an aging population, always in a very negative light, right? That, oh no, now we have 1/4 of Singaporeans who are going to be 65 and above, and this is going to be such strong liability, and there's going to be a drain on healthcare and so forth. Some are inevitable. Of course, when you grow old, you're going to need more care. But there's always this assumption that the minute you retire, you disintegrate and you become a liability and a dependent, right? And so we use the old age dependency ratio to scare ourselves. What a pity, because if you think of somebody who has been taking good care of themselves, right? Financially, physically, health-wise, mentally, who has nurtured relationships, is well connected in a group of like-minded friends, in the community, with family. This person, when he or she retires, for the next 20 or 30 years, a big chunk of that will be spent in good health. People who are in their late 60s, in their 70s, who are still in good health, they are such assets to the community. We must continue to tap on them for their experience, their wisdom, and the fact that they are no longer economically locked up in a 9-to-5 job also frees them up to be important volunteers in the community. As we started off actually not calling it successful aging, we called it preventive health, right? It was a health project. We surfaced the model and looking at the influence of education, all the background factors, social support, and so on. And then we started qualitative research. So we always start, even though I'm a quantitative sociologist, but before we roll into the survey, it's always good practice, especially when we are dealing with emerging issues, to go first into the ground, right to the ground, and get a ground sensing through focus groups interviews. In the post-50 group, all the ideas of what constitutes successful aging came out, and we collected all the interviews, looked at it very carefully, and then we constructed a scale, an index to measure successful aging. And then subsequently with that index, we went into the survey stage and we were able to validate it. So we found that, Singaporeans tell us that successful aging included constructs of healthy aging, aging independently, self-sufficiency. This notion of self-sufficiency, being able to take good care of themselves so that they will not be a liability to their children, came up very, very strongly. So that was a very interesting finding for us, right? So I think we will move, and we have to, it is inevitable and we have to do this, move towards a community where the young old will become very important source of social support for the old. We see this in Japan, right? We see this elsewhere in the world. But in Singapore, I think that's something that we have to work towards.